Hello, everyone. Welcome to another episode of the Anti-Pharmacist podcast. It has been too long since you heard my voice last, and I must say that I miss podcasting, guys. But there are some times in a person's life where you have to just take a step back and just do some things for yourself. Well, that was what I had to do. I record from Nigeria, and a lot of things happening in this country right now, and you have to guard your mental health. You understand? And apart from this, I had other things to do. That's not an excuse, okay? I'm sorry for the long break, but it was quite necessary. That's just what I was trying to pass across, you see. And there were some changes to some podcast hosting channels, you see, and I had to study them, and adapt so that I would be able to bring the podcast to you as usual. For example, now Google Podcasts is no longer in use, it's no longer in service, it's now YouTube Music. So you can get Anti-Pharmacist podcast on YouTube Music henceforth. That being said, I'm back, guys, and it's so good to be back. So on today's episode, I'll be discussing drug use in geriatrics. Actually, that was supposed to be the last episode of season 2. I wasn't able to record due to, circumstances like the ones I explained in the beginning of this episode. So I'll be discussing that, and that will be the opening episode for season 3. And so let's get right into it. I missed saying that, actually. Well, what are the geriatrics, if you ask me? They are the elderly people amongst us, and you could actually classify them from, say, age 60 and above. Those people, they are no longer in their midlife. They are now old people, according to biology, because some old people don't even want to be old these days. You see them and they'll still be like young people, but you know what I'm saying? I'm talking about age. And the age of the body and the effectiveness of the organs, let me put it that way. So geriatrics are people 60 and above, or you could say 65 and above, okay? So at this stage of life, a lot of things happen to the body, to the organs. They age, they grow old, the skin starts to sag, and it's most times retirement age for most people. You understand, especially those that do government work, civil servants, and all of that. Activities reduce, okay? Lifestyle changes, so most of them are not as active as they used to be. They become sedentary. You see, there's muscle wasting. People that used to be so big, they start shrinking. It's part of the normal aging process, and because of the muscle wasting and shrinking, skin begins to sag, eyesight begins to reduce, the loss of teeth and all of that. Of course, graying of hair. It just goes to show that the body is aging, and because of this, a lot of diseases accompany old age. I've mentioned loss of eyesight. That's why you see glaucoma in a lot of old people. You see cataracts and the rest of them. Hypertension, diabetes mellitus, arthritis, very common. And for men, you start hearing of benign prostatic hyperplasia, because of reduced sexual activity most times. Then for women, you see postmenopausal syndrome. Of course, they are not menstruating anymore, so all those hormones start disturbing the body in other ways. You see, there's some women start experiencing hot flushes, headaches. So a lot of things happen in old age. See, this is not to scare anybody, okay? Because we are all going to grow old. And you see, God has made it such that even if there's a problem, there will always be a solution. So we know what causes most of these things. At least I've mentioned them. And the crux of it, the summary, is loss of activity, or should I say reduced activity. So if you want to prevent this, it's telling you, right, that there are things that you can do. So that will be another topic for another podcast. But today I just want to talk about drug use in geriatrics. So I've talked about the aging of organs, I've talked about the different diseases that happen in old age. So of course you have to use drugs now to combat all these diseases. Okay? And remember, the major organs of excretion of medications are metabolism, the liver, excretion or elimination, the kidneys. They are also aging as the body is aging. So you have to be very careful while administering drugs to the elderly. That is why in the elderly, you have to reduce sometimes dosage of medications. I've talked about drug use in pediatrics. I've talked about reasons why their dosages are not the same as adults. And now we know the age range of adults. You can say between 18 and 60-ish, right? So from 65, because of the aging organs and because of muscle wasting and reduced weight, those drugs that are given based on weight, you have to, reduce the dosage for the elderly. And others that are majorly concentrated in the liver and eliminated majorly by the kidney, you have to reduce the dosage as well so that it doesn't even harm the organ further. Okay, so that has told you how age affects dosage of medication, right? Because of old age, there is a phenomenon called polypharmacy in the elderly. Now, they use a lot of medication. Some have comorbidities, like I told you. Some people will have high blood pressure combined with diabetes, with arthritis, with glaucoma. So you see one person using like 10 medications at once. And don't forget, the brain is also aging. So some begin to forget things, there's forgetfulness. Some even develop Alzheimer's and dementia, you understand? So that's a problem. Adherence becomes a problem. We're supposed to take a medication in the morning. Oh, they forgot. And now they took it at night. Or they didn't even take it at all. It becomes an issue. Now you are combining like 10 medications because of their different health conditions. Meanwhile, the liver is being overburdened. The kidney is overburdened. Even though you have reduced the dosages, it's a lot. So drug use in geriatrics is one particular point in medicines or medications use that has to be looked into. It is very important. And that is why for polypharmacy, for example, I've talked about drug interaction extensively on this podcast. Drugs interact. Some, they work together by a phenomenon known as synergism. They work together and they work better. Some, when combined together, they cause potentiation. That is, the individual action of the drugs are exponentially multiplied, and this could lead to toxicity. Other drugs cancel the effect of one another by a phenomenon called antagonism. At the end of the day, drugs are rendered ineffective. There's therapeutic failure, and the drug is inert in the body. The condition for which you took it does not improve. All of this. Now imagine combining like 10 medications. There will definitely be interaction. It's only in very rare cases that you combine that amount of medications without interaction. So what do? How do you maximize therapy in this group of people? One major solution, or should I say one major way to deal with polypharmacy, is single dose combinations of medicines. Of course, they are very expensive because of the technology that is involved in making them. But if you could get them or get your hands on them, it is much more advantageous. For example, you're using Vasatan and hydrochlorothiazide. You need medications like Codiovan, which is a combination of both, in one single tablet. You understand? So that they don't have to take so many medications, because even that alone, having to take a large volume of medications, actually irritates and discourages people from using them. Okay? Another thing is using pill organizers. Especially in cases of forgetfulness, you can get pill organizers. These are like plastics that have different sections in them that are separated and labeled, according to number of days. So you already put the number of medications to be taken each day. There's Monday, Tuesday, like that, days of the week. And just put them there so that you don't have to be taking medications out of their packages all the time. But remember that you have to store medications well. So put these medicines where children will not get to eat, where unnecessary heat will not get to eat, where moisture will not touch it. So these pill organizers should be tightly closed, alright, and placed in a place that will be easily accessible to only the person that needs it. And of course, you can always set your alarm or your reminder to remind you that, take your pill today. Just go to your pill organizer, take it, open the one for that day and use it. You understand? Keep it for the next day. And when that week is exhausted, remember to refill. Most elderly people have caregivers around them. So this could be one of the tasks that the caregivers will have to undertake or embark on. So drug use in geriatrics is just more than taking medications. You have to always consult your healthcare provider if you're experiencing any side effects, no matter how little. Even if it's as simple as gastrointestinal disturbance or dizziness, which happens a lot in adults, even without taking medications. Dizziness, which predisposes them to fall, is another downside of aging. So you have to be careful. Any adverse reaction or side effects you are feeling from medications, please let your healthcare provider know so that they can know the culprit medication and see if it can be substituted or look at a way to circumvent that side effect or treat it appropriately. Drug use in geriatrics should not be taken lightly. If possible, older people should not be left alone to take care of themselves. I know that it may not be easy, empty nest and all of that. Once the children have grown old, they are taking care of their own lives. They go their separate ways. They only come on holidays or on leaves to see their parents once in a while. You could get somebody to be with them, to take care of them, especially if they are on medications. Please don't leave it up to them. Don't say, mommy and daddy are together now. Mommy will give daddy his medication, or daddy will give mommy her medication. Don't forget that both of them are growing old. They could forget that he could have some illnesses of his own that mommy does not have, and she in turn could have some of her own. So it's good to have a third party that will take care of them. Of course, it comes with some financial responsibility, but then we just got to do what we got to do, right? So that at least they age well. They still enjoy their old age. There's nothing wrong with somebody growing very old till their ripe 90s and 100s. People treat all these diseases for years. Once they are able to manage them well, then it's fine. So that is just what I want to bring to your notice about drug use in geriatrics. There are a lot of things to consider, but the major one is the combating of polypharmacy. And I've given you different ways in which you can actually do that, okay? Using single pill combinations, using pill organizers, and of course giving drugs based on their weight and reducing dosage based on the burden and the organs of metabolism and excretion. And that's all I have for you on today's episode of the Antipharmacist podcast. By God's grace, we'll see next time. And that should be Friday, right, for our TGIF episode. Till then, stay healthy and God bless you.